Hello and welcome to my research proposal presentation. My name is Brenna and this presentation will be overviewing a proposed research study looking at the effectiveness of inhaled isopropyl alcohol in reducing nausea for adult emergency department patients. The rationale for the importance of this study is that nausea is a common and distressing symptom in the emergency department. Approximately 4.8 million ED visits in the United States each year are related to nausea or vomiting. More than 50% of adults report at least one episode of nausea within the last 12 months. Ondansetron, also known as Zofran, is the most common antiemetic medication used to reduce nausea in the emergency department. But numerous studies have shown that ondansetron is not more effective than other antiemetic medications or placebo in reducing nausea for this population. Inhaling isopropyl alcohol may complement traditional ondansetron therapy for reducing nausea. Statement of the problem. Nausea is commonly reported in the emergency department and typically managed through antiemetic medications such as ondansetron. But when used alone, ondansetron is not more effective than other antiemetic medications or placebos in reducing nausea. Complementary therapies such as inhaled isopropyl alcohol may increase the effectiveness of ondansetron with the reduction of nausea. Research purpose. The purpose of the study is to investigate the effectiveness of inhaled isopropyl alcohol in combination with 4 milligrams intravenous ondansetron as a strategy for reducing nausea in emergency department adult patients. Research question. In adult emergency department patients, what is the effect of intravenous ondansetron and inhaled isopropyl alcohol on the reduction of nausea compared with only the use of intravenous ondansetron? The methodology of my proposed research study includes a randomized controlled trial design where patients are randomly assigned to a control group and an intervention group. Unfortunately, blinding is not possible due to only one researcher in this proposed design. A convenient sample of adult emergency department patients with age parameters of 18 to 70 years old who report nausea with or without vomiting and have 4 milligrams of IV ondansetron ordered will be used. Inclusion criteria is receiving 4 milligrams of IV ondansetron for nausea, a self-reported nausea severity of 3 or greater on a verbal numeric rating scale of 0 to 10 upon arrival to the emergency department. Exclusion criteria are a known allergy to isopropyl alcohol, inability to inhale through the nares, pregnancy, and clinical intoxication. A sample size of 100 adult patients with 50 in the control group and 50 in the intervention group will be used, and the setting is the Level 2 Trauma Center Emergency Department in northwestern Wisconsin. For data collection, a verbal numeric rating scale from 0 equals no nausea to 10 equals severe nausea will be used to collect a self-reported nausea severity. This data collection tool will be used to collect information prior to administration of the intervention for a pretreatment score, and again 30 minutes after intervention administration for a post-treatment score. The data analysis plan will include calculating the average numeric rating scale score for the pretreatment and post-treatment scores of both groups. Then, a t-test will be used to compare the difference between the post-treatment mean of the control group and the post-treatment mean of the intervention group. The level of significance will be set at p is less than 0.05 level. Alright, now we can review some questions that I have related to some challenges and barriers within my study. The first question I have is, should a comparison of the mean numeric rating scale score be made between the control group's pre-treatment mean and post-treatment mean, and same with the intervention group? My thoughts include using a t-test to compare the pre-treatment and post-treatment means of both groups to demonstrate whether there is a difference in nausea reduction after intervention administration within the same group. I think that using a statistical test between this data, even though it is not directly linked to my research question, has the potential to strengthen my research data as a whole. If there is a significant reduction in nausea from an intervention group versus not a significant reduction in nausea within the control group, then this will show in favor of my research. My other concerns is that it may work in the opposite fashion. It may show that there was no significant reduction in nausea for the intervention group, but a significant reduction in nausea was present with the control group, which I guess within research we want to show both sides of it, so that would work too. But I didn't know exactly how many t-tests I should run and how many was too many. So if I could get a little bit of feedback on that. My second question was, is a randomized controlled trial with a convenience sample appropriate for this research proposal? I've been going back and forth on this. I think that a convenience sample is definitely appropriate since patients will be taken from the same emergency department only when the researcher is present. This means that even though biases are being increased, it's also cheaper and more convenient because nobody will have to be properly trained. Only the researcher is going to be involved in collecting data. Also, I think the randomized controlled trial is okay because the plan for this proposal is that participants will still be randomly assigned to the control group and intervention groups. They just won't be a random sample because it's going to be only available when the researcher is present. So if I could get a little bit of feedback on how that sounds. And then the third question is, as a single researcher, how can I prevent my participants from guessing whether they are in the control group or the intervention group? Again, my thoughts on this were kind of using a plainly packaged pads that either have the isopropyl alcohol on them or normal saline, depending on if they're in the control group or the intervention group. And having these outsides look the same, having the pads look the same, have everything be the same except for just having what's in them be different. I understand that alcohol has a little bit of a smell to it, but I don't know if the average person's going to realize that or know that. So if I could get some thoughts back on how to prevent my participants from guessing which group they were in, I think that these are the main issues that I'm still kind of trying to hash out as I'm looking at creating this proposal. So any feedback would be helpful, and I hope that you guys enjoy this presentation. Thank you.